Join the movement. Listen to Dr. Erica David teach about things everybody should be doing and eating to keep their mind and body healthy. Watch the full ad-free reasoning now, only on www.ineverknewtv.com premium.
I'm seeing a lot of people outside. I see them look a certain way one day. I see them the next day, they look a different way. I want to talk about this Ozempic, right?
Yes.
So, why are so many people taking it Ozempic, and what are the potential dangers associated with it?
Yeah.
Not just physical. I want to talk about the mental also.
Oh, good, because that's on my list, 100%. Yep. Ozempic. Yeah, it's an interesting one. I think, sadly, I think one of the reasons so many people are doing it is the quick fix mentality. Unfortunately, it technically works. It'll make you lose the weight, and some people see that and they see, oh, so and so or this celebrity or someone took the Ozempic and they lost 50 pounds. I want to do that. I think anything. My thought in life, just again, as I age, as time goes on, a lesson I've learned is anything that seems too good to be true probably is, right? There are going to be some adverse effects there, and that's what we're starting to see, right? So I'll start up with some of the basics. So some of the basic side effects you can get from Ozempic are not nice but simple. So you can get like nausea, vomiting, diarrhea, things that just stomach upset, that sort of thing. So that's kind of the basics that we can look at there. We're also seeing other things like pancreatitis, so inflammation in your pancreas. That's a big one that we're seeing also. You mentioned the mental health piece. I think it's intriguing. So there have been, again, the scary thing with Ozempic is it's still pretty new. So Ozempic, and there are others, they're called like GLP-1s. There are others in that class, but Ozempic's like the one that seems to be one of the bigger ones we're talking about. They're new, right? They have not been around for that long. So studies are starting to come out, seeing some of the detriments of them. I just want to call out that we don't know what's going to happen like 20, 30, 40 years from now. We don't know what the long-term effects are going to be. So that's the part that's a little scary. But I'll pause and move on to the mental health part. So some of the studies that are starting to come out are seeing things like increase in depression, decrease in anxiety, increase in like sleep disturbance, like insomnia. So that is showing up. They say so far that the studies they're looking at, it's more common in people maybe where there's like a family history or they have a prior history of it. But again, as I noted, it's new. So we don't know long-term what's going to go on there. Other interesting things, I think, other than the mental health, also some of the physical stuff. So yeah, you lose the weight, but you're also losing muscle. And that is not good. I talked about, again,
That's where that zombie look come from.
yeah, that's where that's where that Ozempic face, that kind of look comes from. Yeah, so they're losing that muscle mass, and right, some people, they see it on their face, like where they're getting like, that wasting of the skin, like they don't have any like substance to their faces, their eyes are sunken in. That's the Ozempic, but also too, just in terms of general muscle mass, right? So as I noted again, as we age, our naturally, that's unfortunately the way it works, is that muscle mass starts to decrease as we age. That's why, for myself, I love cardio. Like I always did cardio. Once I hit my 40s, I was like, okay, I need to add some weight training. Now I'm in my 50s, so I'm like, I'm loving the weight training. I think this is a thing we have to do. But if you take Ozempic, your muscle mass is going down. So yeah, that's particularly dangerous, because then people are more set up for more adverse effects, or falls, things like that. Falls and osteoporosis. If you have those things, next thing, you have a simple fall, you have a fracture. I mean, all these things long term are results of Ozempic, essentially, because you're losing that muscle mass.
And the concern I have with all these weight loss things is
Yeah.
that you didn't change your lifestyle or create a system to sustain this weight.
That too.
So like,
Yeah.
I don't know how does this work? Like,
Yeah,
you
no,
have the
'cause-
same mentality. so-
because the thing is with Ozempic, right? There are some situations in which it might be the right thing for someone. I just have to be honest on that piece as a physician. There's that. And if someone has tried all the stuff, so they've gone, they've tried all the diet, all the exercise changes, they've done everything else, and they're still morbidly obese, they're at a point where the risk is so high of adverse health effects due to their weight, and they, like I said, they've tried everything else, then maybe that is a person who's a candidate for Ozempic. That's when I'm like, okay, maybe this person needs to try it. But we're not seeing that. We're seeing that people, unfortunately, someone's like, oh, I want to lose 15, 20 pounds for, I'm going to I'm going to be in a wedding or something. I want to lose 15, 20 pounds so I look nice in my dress. They're like, I'll take Ozempic. That is not what we're supposed to be doing. That's when you really should be doing like the normal diet and lifestyle changes and things like that. The danger with, people that are starting to take the Ozempic, they're not doing those things. They're not taught what they should do. And then also, once they stop taking the Ozempic, right back, right back. Yep. And they never learned anything. So, yeah.
I think that'd be more of a burden on their mental health, that whole process. The
That
attention that they
too.
get, they lost the
Yeah.
weight now.
That's a good call out too.
They're
Yeah.
back
So
in it.
separate from like I talked about with the depression and anxiety, there's that piece too, just psychologically. Yeah. What's that going to do to a person? That's hard.